Compartments of the thigh, just like compartments formed in the upper limb, compartments in the region of thigh are also formed with the help of intermuscular septa, which are basically the extensions of deep fascia of the thigh, that is fascial ladder. And these intermuscular septa, after arising from the deep aspect of the fascial ladder, they extend towards the femur and get attached over the lateral and the medial lips of the linea aspera, hence dividing the region of the thigh into at least 3 compartments. The compartment located on the anterior aspect of the thigh is called anterior compartment. The one on the medial side is called medial compartment, and one on the posterior aspect of the femur is called posterior compartment. So basically, femur is surrounded by in majority, by the anterior compartment of the thigh. The anterior compartment of thigh is unique in the sense that it contains 2 groups of muscles depending on the actions of those muscles. That is, anterior compartment of thigh comprises of 2 groups of muscles. First group is the flexor of the hip joint, whereas the second group in the anterior compartment of the thigh is extensor of the knee joint. So by flexors of the hip joint, I mean that these muscles, which are called flexors of the hip joint, they are going to flex the thigh at hip joint, whereas extensors of the knee are going to extend the leg at knee joint. Medial compartment of the thigh is also called adductor compartment of thigh because the muscles included in this compartment, their main action is to adduct the thigh at hip joint. Last compartment, which is the third compartment of the thigh, also called posterior compartment, is also named as flexor of the knee joint. Flexors of the knee joint means this particular compartment is going to flex the leg at knee joint. Posterior compartment of the thigh is also called hamstring compartment. Why we will inshallah look into the detail of this name of the posterior compartment of thigh, that is hamstring compartment of the thigh, when we shall study the posterior compartment. So these are the 3 compartments of the thigh. The nerve supply for the anterior compartment of the thigh is mainly derived from the femoral nerve. For obturator, nerve supplies the medial or the adductor compartment of thigh, and sciatic nerve, especially its tibial portion, because sciatic nerve comprises of 2 portions, tibial nerve and common peroneal nerve. So mostly tibial nerve supplies the hamstring or the posterior compartment of the thigh. So the hip flexors or the muscles that flex the femur at the hip joint include Iliopsoas, which is basically a combination of 2 muscles, that is psoas major, iliacus. Then we have Sartorius, Pectineus, and tensor fascia lata. The extensors of the knee joint include 4 muscles, which are together called quadriceps femoris muscle. Please do not confuse this muscle with the other muscle, which is called quadratus femoris. These 2 are different muscles. Quadratus femoris and quadriceps femoris are 2 different muscles. Quadratus femoris is a single muscle with two heads, but quadriceps femoris is a group of four muscles. The names of those four muscles are rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius, which is visible only if you cut the rectus femoris, because vastus intermedius lies deep to the rectus femoris. So in order to see the vastus intermedius, you will have to cut down the rectus femoris first. Now taking a look at the attachments of the muscles of the anterior compartment of thigh, let's first take into consideration the flexors of the hip joint. Here in this diagram, you can see two muscles very clearly. This one that is arising from the sides of the bodies of the lumbar vertebrae is the psoas major muscle. And here from the iliac fossa of the iliac bone is taking origin the iliacus muscle. Together, these two muscles are called iliopsoas. Just look at the position of these two muscles in relation to each other. Psoas major is located medially to iliacus, which is located laterally to psoas major muscle. Here in this side, another muscle is also visible, which lies above to the psoas major muscle. This is called psoas minor. So these two muscles together, they are called iliopsoas, and these are the proximal attachments of these muscles, that is lumbar vertebrae and iliac fossa. These two muscles together, they get attached over the lesser trochanter of the upper end of the femur. Their main innervation is derived from the femoral nerve, which is a branch of the lumbar plexus having root value L2 and L3. Femoral nerve arises from the posterior division of the lumbar plexus. The action of these two muscles regarding the innervation of the iliopsoas muscle, it is said that iliacus muscle may receive the nerve supply from femoral nerve as a branch of the posterior division of lumbar plexus, whereas psoas major may receive direct contribution from the lumbar plexus from the levels L1 to L3. So iliacus may have its own nerve supply from the femoral nerve, whereas psoas major may have its own nerve supply arising directly from the ventral or the anterior rami of the lumbar plexus. This muscle is very important muscle. Iliopsoas is a very important muscle because it not only acts to flex the hip at the hip joint, flex the thigh at hip joint, but also it maintains our body posture. So it is also called a postural muscle because, as you can see, particularly pay attention to the psoas major muscle, which is arising from the sides of the bodies of the lumbar vertebrae. It is active during standing. Why active during standing? What is it doing while we stand? It is basically maintaining the lumbar lordosis. What is lumbar lordosis? This is lumbar lordosis. The spine or the vertebral column is in the form of curvatures. Here in the abdominal region, the lumbar part of the vertebral column shows an inward curvature. This inward curvature is called lumbar lordosis, and it is maintained with the help of this muscle called iliopsoas, particularly the psoas muscle. So it also not only a flexor of the thigh at hip joint, but it also is a postural muscle, helping us to stand erect by maintaining the lumbar lordosis, which is the inward lumbar curvature of the lumbar part of vertebral column. So this was all about iliopsoas. Now let's move on to the sartorius muscle. Sartorius muscle is the superficial most muscle in the whole anterior compartment of the thigh. It is also a flexor of the thigh at hip joint. And as you can see in this diagram, it is a very flat strap-like, ribbon-like muscle extending proximally from anterior superior iliac spine, reaching or crossing the thigh anteriorly in the lower part medially to get attached over the medial aspect of the knee joint. It is also called Taylor's muscle. It is also the longest muscle in the body, and we did study the proximal attachment of the sartorius, which was on the anterior superior iliac spine, and its distal attachment is at the medial surface of the upper part of the tibia. Tibia is the medial bone in the leg. It has an upper end, and the medial side of that upper end of the tibia provides attachment to the sartorius muscle. So sartorius arises anterolaterally, crosses the thigh anteriorly, reaches the medial side of the thigh to get attached over the medial surface of the upper end of the tibia, which is the bone in the leg. It derives its nerve supply from the femoral nerve L2, L3. Its main action is to flex the thigh at hip joint, but it may also abduct and laterally rotate the thigh at hip joint. And along with the posterior compartment muscles, it may also help in the flexion, not extension, but flexion of the knee joint, leg at the knee joint. Next muscle is Pectineus. Here in this diagram, you can see Pectineus, which is a very short muscle, quadrangular, almost quadrangular in shape. It is located in the supromedial aspect of the thigh. So if you take into consideration the location of the muscles, you can see that it is covered medially by the adductor muscles of the adductor compartment of the thigh. You will have to cut down all of these muscles in order to take a look at the pectineus muscle. And pectineus muscle is located medial to the iliopsoas muscle. So we can say that iliopsoas muscle is present over the anterolateral aspect of the superior part of the supromedial part of the thigh, whereas pectineus is located medially in the supro-anterior part of the thigh. Pectineus muscle, as the name is indicating, it is arising with its proximal attachment from the pectineal line or the superior border of the superior ramus of the pubis and gets attached on the same named line, that is the pectineal line, on the femur. Its postero-superior aspect, just inferior to the lesser trochanter. Here in this diagram, you can see the lesser trochanter. Since it is located medially in the supro-anterior part of the thigh, it is naturally its actions, they become adduction of the thigh at hip joint and flexion of the thigh at hip joint. Also assists the medial rotation of the thigh at hip joint. It may either have dual nerve supply or single nerve supply, depending on the presence of the accessory obturator nerve, which when present is a branch of obturator nerve. And for most of the part, Pectineus receives its innervation from the femoral nerve, L2, L3. So this was all about the flexors of the hip joint. Next muscle in the next group of muscles in the anterior compartment of the thigh are called quadriceps femoris, or simply the quadriceps. Quadriceps meaning four. So this group of muscle comprises of four muscles in it. And these four muscles are anterior, and in the midline, we have rectus femoris. On both sides, that is the medial and lateral. On the lateral side, we have vastus lateralis. On the medial side, we have vastus medialis. And if you will cut down the rectus femoris to expose the vastus intermedius muscle. Together, these muscles are called quadriceps femoris, or simply the quadriceps. Quadriceps meaning four. Do not confuse this group of muscle with another single muscle with two heads, which is called the quadratus femoris, right? So let's move on to see the description of these four muscles one by one. These four muscles, quadriceps femoris, they form the bulk of the anterior aspect of the thigh, since they are covering both the anterior and sides of the anterior aspect and medial and lateral aspects of the thigh. So they are mainly forming the bulk of the anterolateral and anteromedial aspects of the region of thigh. If in this diagram, you will pay attention to the attachments of the rectus femoris. Rectus femoris proximally, just like Sartorius, is arising from the anterior superior iliac spine. As well as just superior to the acetabulum. Vastus lateralis arises just beneath the greater trochanter and lateral lip of the linea aspera. We studied all these attachments in detail when we were doing the attachments on the femur bone. Third muscle is the vastus medialis, which is arising from the intertrochanteric line and medial lip of the linea aspera of the femur. And vastus intermedius, since it is lying over the anterior aspect of the femur bone, so naturally it's taking origin from the anterior surface, majority part of the anterior surface of the shaft of the femur. All of these four muscles, that is rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius, via a common tendon, which is called the quadriceps tendon. Their distal attachments merge into a single tendon, which is called the quadriceps femoris tendon. They get attached into the knee joint, especially around the patella, which a layman is also known by the name knee cap. So these four muscles, their distal attachments, they fuse to form a single strong broad tendon, which is called the quadriceps femoris tendon. This quadriceps tendon gets attached into the patella, okay, which is also called kneecap by a layman. And we know from our medical knowledge that patella is basically what? Patella is a sesamoid bone, body's largest sesamoid bone. So this quadriceps femoris tendon gets attached into the patella with the help of a ligament, which is called patellar ligament here. This patellar ligament is basically an extension of the tendon itself. And this extension is basically doing what? It is uniting or anchoring the single tendon of these four muscles into the patella. So patellar ligament is basically the continuation of the quadriceps tendon. So here you can see that at this level, merging of the four muscles has occurred to form a single quadriceps tendon. This is patella, and this ligament here, patellar ligament, is making the distal attachment of these four muscles firmly into the upper part of the tibia. The upper part of the tibia shows a bony prominence here, bony prominence. We can also feel this bony prominence in the anterior part of the leg, anterosuperior part, and this bony prominence in the upper end of the tibia is called tibial tuberosity. So with the help of this patellar ligament, which is basically what an extension or the continuation of the quadriceps femoris tendon, it is helping to anchor or give firm anchorage to the quadriceps tendon into the tibial tuberosity. The vastus lateralis and medialis, they also may get attached around the patella via independent attachments besides this quadriceps tendon. And these independent attachments are labeled as medial and lateral patellar retinacula. These retinacula, they merge with the capsule of the knee joint to provide reinforcement to the joint capsule on each side, lateral and medial side. All of these four muscles, they receive their innervation from the femoral nerve, root value L2, L3, and L4. Action, since. Look at the location of the four muscles, rectus femoris, vastus lateralis, vastus medialis, and deep to the rectus femoris, vastus intermedius. Together they are known as quadriceps femoris or simply quadriceps. They are located over the lateral and medial sides of the thigh, and they are getting attached around the knee joint, anterior aspect of the knee joint. So naturally, they are going to do what? If they will contract to their proximal attachments, if the line of pull of their contraction is towards their proximal attachments, they are naturally going to extend the knee joint. And what part of the lower limb will be extended at the knee joint? Leg. So we can say that quadriceps extend the leg at knee joint. So this was all about the muscles of the anterior compartment of the thigh. Since if you pay attention to the muscle rectus femoris, it is crossing two joints, hip joint superiorly and knee joint inferiorly. So again, naturally, it is going to have some actions on hip joint as well. And what is that action going to be? Flexion with the help of rest of the flexors of the hip joint. So it may help in flexing the thigh at hip joint. And another point to be noted regarding the rectus femoris is that among the quadriceps muscle, it is the only muscle that is crossing the two joints. That is hip joint and knee joint. So this was all about the muscles of the anterior compartment of the thigh.